Hey guys, welcome back to my channel. I kind of wanted to talk about that little gap in between when you've graduated from nursing school, you're studying for your NCLEX, and you're applying for jobs. If you're having a little bit of stress about that little gap of time, this video is for you. So let's get into the nitty-gritty. So I remember when it was kind of like right before I was taking my exit exam for nursing school that I was like, uh-oh, I think I made a mistake, because it's like you're studying for all this material that obviously you need in the workforce, but it wasn't about not knowing the material or anything content or knowledge based that I was stressing out about. I was starting to stress out about the fact that I was going to be on my own without, anybody telling me what I needed to do. It's almost like I was going to have to transition from being somebody who's being taught to someone who's leading. And I was like super stressed about that. I literally thought to myself 100 times a day that I had made a mistake becoming a nurse. Like, yes, I know the material. Yeah, I know the content. But the fact that I have to have my own autonomy and I'm the one that's, taking care of patients and no one is really guiding my tasks during the day. I don't know, I guess it was like, I guess I had been so used to being a follower and not a leader, and I hadn't quite transitioned in my mind yet how I was gonna do that. So obviously I had the stress of those exams and then the stress of the NCLEX coming up. So I was kind of like, my anxiety for that was like in the back burner, because obviously I had to focus on, what I had worked so hard to do. So I was gearing toward taking this test, and it's just still looming on me the fact that I'm gonna be on my own in a little bit and I'm not ready, and I don't think you're ever gonna feel like you're ready until you're in it. Once you're in the field, you have your job, you're being oriented to the unit, you're being oriented to the hospital, things get a little different. It gets a little it's a little more comforting knowing the ins and outs and what they expect of you and how to time manage and things like that. So I want you to know that even though this time where you've graduated from nursing school and you haven't quite started your job yet, it's normal to be anxious about what you're about to embark in. But I want to tell you as well that it is a beautiful experience. Yeah, you're gonna have terrible days. Yeah, you're gonna have moments where you regret everything. You might cry on the way home, but in the end, it's all worth it. I feel like it's one of the most beautiful and prestigious careers you can ever aspire toward. Don't quit on your dreams. I've watched many YouTube videos of people who've mentioned that they regret getting into nursing. But I'm here to tell you that although bedside may not be for everyone, there are so many other options that you can do in the field of nursing that you shouldn't regret your decision to have become a nurse, or that you're about to finish your nursing school process in becoming a nurse. Let's say you do get started and you don't like your floor. Let's say it's a med-surg. Most people at a nursing school aren't fortunate enough to be in a specialty. So if you're put in med-surg and you absolutely hate it, most places have contracts between 6 months to a year. So I say tough it out, get that bedside experience in med-surg. Most places kind of look for that, or that at least that you have some sort of experience. That's gonna get your foot in the door in other hospitals. Maybe you're in a hospital you don't even particularly care for. Maybe it's outside of your comfort zone of driving. But if you just put in that time, it's gonna pay off in the end, because once you have that experience, you can start to look at other options in terms of maybe other specialties that you're interested in. And you can look into doing transition programs where, let's say you wanna specialize in OR or PACU or L&D. There's so many different avenues in terms of what you can use your nursing license for, that if you put in that time, you can obviously use that as an experience. Obviously have good rapport with your leaders so you can have nice references and just move on. That's the part of it, that you don't have to be stuck somewhere because you got a job in that spot, so you're like, oh, I got this job, so I'm stuck here. No, obviously your happiness comes first. So always look at where, what makes you feel happy, and then try to look at avenues in the field of nursing that maybe will get you there. Let's say you've tried them all. Let's say you've tried a few and they still aren't for you. You don't like the workload, you don't like the stress, you don't like the, dealing with the bull crap or whatever it is. It's understandable. All of us go through a little bit of burnout at some point, but maybe bedside just isn't for you. If you've put in some time, maybe you can work in administration, maybe you can work in leadership. Maybe you can develop other nurses, or if you like to teach, maybe you can be a clinical educator in certain floors. There's just so many options. Like, I don't know, I can talk about it for days, but you can even go into informatics. You can do your master's in nursing informatics and make boku bucks like that. You can develop the software that nurses use. It's just, I can't even get into how far this video is probably going to be like 30 minutes long if I talk about all the different options that you can do as a nurse. So don't be discouraged. Don't get down on yourself. Keep pushing. You're almost there. If you're having issues finding work, that's not something that I know much about because I did get a job right away, but don't give up. Just continue searching, continue putting resumes out there, continue trying to better yourself as a person, maybe do some more community work, things that you can say in your interviews that maybe make you stand out better as a candidate compared to the other people that are applying for that position. What are some things that you can do when you first get started to maybe ease the process in terms of becoming a leader? One thing you can do to start off is to work on your time management. So what you can do is kind of once you've gotten a report on your patients, make a list hourly of what the things that you need to do. If you need to give meds at a certain time, if you need to do assessments at a certain time, just mark those times so that you can be on top of yourself, and that way you don't feel lost. And try to budget yourself as well with charting, because you can get caught up in things, or let's say you say, all right, this is where I'm going to start charting, and then something else goes on, or someone else calls you, or they need something over here, or you need to do something over there. Just try to budget yourself in terms of charting, because you don't want to get stuck at the end of the day after you've already given a report charting on all your patients. We've all done it. Obviously, if you're behind, you're behind. The most important thing is the nursing care and making sure that the orders are fulfilled. But if you can budget yourself some time to chart, that's amazing. And you also don't want to skip out on your lunch so that you can catch up a little bit. That 30 minutes for you to chart, really when you can eat and be ready for your patients and be, able to take care of them. The second thing you can do in terms of preparing yourself for the workforce is trying to, understand that no one knows your personality, or they don't really know you right off the bat. So what you can do is just make yourself available to them. Like, hi, I'm so-and-so, I'm new here, blah, blah, blah. I'm sorry if I bother you a lot, but I might have some questions, right off the bat, so they know who you are and what you're requiring of them. And then that way, it eases the transition, and then you can try, if you've budgeted yourself well with your time, to help them as well, because then it looks good that you're a team player and that you're able to manage your own time as well and help others, because that also opens the doors for when you need help. If you're ever behind on something, you say, oh, I'm struggling right now, and it's someone that you've helped before that can be like, what is it that I can do to help you? Not everyone is like that, but I'm telling you that if you're a team player, most of the time it's reciprocated. Another thing that you can do to ready yourself for the workforce, or once you've started in the workforce, is to know your worth. I think that's one of the hardest things to feel when you're a new grad, because you're like the bottom of the totem pole. You don't know the doctors, you don't know the other nurses, you don't know the other resources that are available, the pharmacists, things like that. But you have to know your worth. If you value your knowledge, if you value your education, no one's gonna make you feel like you're less than or you're not worthy of that position. But if you give someone how do I want to say this? How do I want to word this? The power to make you feel less than or unworthy, then it's just going to be a vicious cycle. You have to know your worth. I'm not telling you that you should be confrontational or that you have to be forceful with your words. But if you hold yourself to a higher standard, hold your shoulders up, don't feel like, oh, I don't belong here. I don't know why I did this. They're gonna see right through me. You need to, like, obviously own it. Own the fact that you're a nurse. You've done this. You've done all the work to get here. Now you earned it. You deserve it, just like anybody else. The fourth thing I can tell you about this is to also know your limitations. You don't want to be the know-it-all. You don't want to be the person that's cocky or that brags a lot. Just know your limitations. If you don't know something, let's say a certain procedure, like let's say in nursing school, you maybe practiced on a mannequin once, but you've never done it on an actual patient, and you feel like, well, whatever, I'm the nurse, I have to do it. But maybe it's better to have a second set of eyes or a second set of hands. That way it's not compromising the patient's safety. Let's say you've never done an IV before by yourself and now you're gonna go do it. I don't think that's a smart idea. Obviously ask for help, but you also don't wanna have them do it for you. You need to also practice the skills so that you can better yourself, so that you're ready for these skills to be able to manage them by yourself. But if you fail, let's say on a Foley, or you fail on an IV or something like that, at least you tried, and then you're not wasting the patient's time and, making yourself look like a fool. So as long as, you have someone there as your backup, then it's not so bad and you're not really causing any harm to the patient. It is what it is. Sometimes we're unsuccessful in procedures, but you have to continue getting practice. That's the only way you're gonna get better. Just definitely don't do something without, any knowledge of it. That's the worst thing that you could possibly do. If you've never experienced a certain procedure, you can look it up. Usually most hospitals have like kind of like a procedure guidebook in their website portals that you can look up, or maybe there's a book on hand on the unit that'll give you, certain skill sets that you can use so that you're not blind going into something. But again, have a buddy there with you. And finally, what I will mention that may help you, it's not for everyone, but try to find yourself someone that can be your mentor, because not all hospitals have it like defined names like that, but maybe you can join a mentor-mentee program. That way you're done with your precepting, you're done orienting, but you still want, those resources from somebody that has the knowledge and someone that you feel comfortable around. That really does help. If you have a mentor, you can literally just be like, hey, I have this certain drug and I've looked it up, but I can't really find what I'm looking for in terms of, the drug-to-drug interactions. What do you think? Have you experienced this? That way you feel, you have a backup, or, a safe space that you can talk to somebody about something and not feel so silly asking all these questions. Imagine if there's somebody that you're working with and they could care less about your questions, or they're over the fact that you've asked a million questions already. It's good to have that person that you can contact at any time and they'll give you all the information you need without making you feel like you're an idiot or you're silly or you're stupid or I can't believe you don't know this stuff by now. You're not expected to know everything, and there's definitely things that you weren't exposed to in orientation. So obviously you're gonna need help and you're gonna have to have resources for you. So I recommend a mentor without a doubt. If you can get one that you feel most comfortable around, that's even better. Alright guys, that's it for this video. I hope those 5 tips will help you transition into the workforce and becoming a leader. You've chosen a great career. Don't ever doubt that. If you like videos like this, give it a thumbs up. Please subscribe if you haven't already, and I'll catch you guys in my next video. Bye!